Hi, I'm Mike LeCouture, and this is the West Block, politics, perspectives, and players.
This is a difficult and extraordinary time.
Right now, my only job is to make sure that Canadians can keep food in the fridge.
But in difficult times like these, we learn a lot about who we are as a people.
Think of ways you can help to ensure that we get through this together.
We don't just need to flatten the curve, we need to plank it.
We'll provide $27 billion of direct support.
The federal government revealed plans yesterday to shut down the U.S.-Canada border.
There are lonely people. There are frightened people.
And we're just going to be here for each other.
Hi, my name is Lil Ronalds, and I'm calling from Vancouver, British Columbia. And my question is, how long does the COVID-19 virus last on different types of surfaces?
If we start coughing when you get there, like, what do you do?
How will we know when is the appropriate time to seek somebody from the health department?
Now, those questions are being asked around the world as scientists try to find a vaccine to prevent COVID-19 and as doctors attempt to treat its victims. What do we know about it so far? Joining me now from Winnipeg to break it all down is Dr. Jason Kindrachuk, Canada Research Chair of Molecular Emerging Viruses. Thanks so much for joining us, Doctor. First off, given your experience on treating and researching emerging viruses, how different is COVID-19 from others that we've seen in our history?
You know, I think it's actually fairly familiar to us in the sense it's a respiratory virus. It's attacking a particularly vulnerable population in terms of seniors. We know, it's transmitting by respiratory droplets. The difference for us is the fact that it isn't influenza. It's a coronavirus. We don't have any pre-existing immunity from what we've seen to this, and we certainly don't have any vaccines or therapeutics. So this really complicates the issue for us in terms of trying to actually combat a global pandemic.
How much of this virus, though, is still unknown?
Well, looking back on when this virus first emerged, or at least when it was first reported, we're looking at about 11 weeks of time. There is, probably years worth of knowledge that we still need to figure out for this virus. If we think back to 2002 with SARS coronavirus and even MERS coronavirus from 2012 when it emerged, we're still learning. We're still learning on a consistent basis with both those viruses. So I think we fast-tracked a lot of things. Definitely we have a global concerted effort amongst researchers and clinicians to try and figure out what we can as quickly as possible. But it is going to take time for us to truly understand where this virus came from and why it is doing what it's doing.
When you compare the fight and sharing of that research, as you just mentioned, how different of a position are we now in as researchers and as a global community in trying to fight it because we are sharing so much and because we are so interlinked in this sort of global village?
Well, the way I like to continue to talk about this virus is the fact that this is really the first pandemic in the age of social media. And that really has changed the dynamic of how we actually discuss and learn about this virus from both the positive and the negative. So in terms of research, we obviously know cases initially, showed up in China. Chinese researchers were very quick to start providing us with molecular as well as clinical information at a moment's notice. And that has continued on through each region that has been affected by this virus. So that has actually, I think, completely changed the playing field. I think we're able to learn and adapt in real time and hopefully come up with better mitigation procedures as a whole.
I think for people out there, they really want to know and they want you to break it down for us in terms of how long can this live on surfaces? Is it better to wash your hands or to use a hand sanitizer? How much of this is known and what do people need to know about this virus when they're walking around out in public?
So I think we can actually lean back quite a bit on what we know from other coronaviruses. So basically from the 1960s up until 2002, coronaviruses were actually endemic in the population. They predominantly created cold-like symptoms in people that were infected. And then obviously SARS and MERS and SARS-CoV-2 have emerged. Most of the properties that we understand about coronaviruses apply to this virus as well. So surface stability, we think, is probably in the neighborhood of a few hours. There's been some conjecture as to whether or not this transfers on to multiple days, but all of that is under ideal laboratory conditions. So we think that in the natural environment, it probably is something where a few hours is where we're looking at for its actual stability. In terms of washing and disinfection, we predominantly still suggest that, soap and water are by far and away our best ability or our best, I guess, armament to try and combat this virus. Disinfectants and hand sanitizers do work, though they require a specific concentration of alcohol to be able to actually exert any inactivation properties onto the virus. And of course, you get into some issues in terms of how dirty somebody's hands are or how greasy, because all of this plays into the effectiveness of that product. So ultimately, soap and water are by far and away the absolute best thing that we can do to try to clean surfaces and clean ourselves.
Now, if we do take a step back, the last global pandemic that we lived through was H1N1. And some researchers say that that pandemic should have served as a warning sign for the latest one. Now, why didn't we see this coming?
You know, it's a great question, and I've tried to maybe take a step back from being combative about it. I was on the ground in West Africa during the Ebola epidemic, and am trying to provide preparedness and response efforts where and when I can here right now with COVID-19. I think there's some differences, right? So I think we had always assumed that the next pandemic would likely be influenza. So, we saw with 2009 that we didn't quite see the global toll that we had seen in prior pandemics. I think maybe we felt that our preparedness strategy was a little bit better than what it is. And ultimately, what I don't think we were quite prepared for was this potential insurgence of ill and sick patients coming into healthcare clinics and hospitals all at the same time. And that really is what we're concerned about with COVID-19, is the fact that during a flu season, 500,000 people die globally, but they're not all showing up at the hospital at the exact same time. This will stretch our limits and our capacity. Regardless, I think, of how far this virus spreads. We're already seeing that in the United States, and we will see that in Canada. It's a matter of how quickly we can flatten the curve to try and combat the overall toll of this virus.
Okay, thank you very much for that, Doctor. Unfortunately, we're going to have to leave it there. We appreciate you being with us today.
Great, thank you very much.
Well, that's all the time we have for today. Thanks so much for joining us. For the West Block, I'm Mike LeCouture.